The monsoon brings in heavy rain and lush greenery, but it also creates an ideal breeding ground for the mosquitoes. And these mosquitoes transmit a variety of diseases, posing a major health risk during the season. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about the health challenges faced during monsoon, and more importantly, how to stay healthy during this time. Joining our discussion today is Dr. Arshad Punjani, consultant physician and diabetologist from Yashoda Hospital's Somajigura. Welcome to the program, doctor.
Thank you, Dr. Lakshmi.
So Dr. Arshad, the monsoons are here, and so are the diseases which are related to mosquitoes, which are transmitted during the season. So how serious do you think this health issue is?
Yes, Lakshmi, we are again the time of the year where monsoons have started, and as everyone knows, I think even the general public today and all over India, once the monsoon starts, the infections are on the rise, especially viral infections like dengue fever, chikungunya, and all the other viral flus. So monsoons are always a big risk for Indian population because of our environment, the number of population which is increasing by the day, and close contacts which we live in, and the cleanliness of our Indian population is actually on the rise. I think post-COVID we are much better than what we were pre-COVID. So infections, if you compare in today's year, I would say it's much better than what we were pre-COVID. But yes, infections are on the rise, especially children and young adults who get much more affected with these viral infections. So yes, like you rightly said, this time of the year we are always under risk for viral infections, and the monsoon plays a big part in that because of the mosquito breeding, which is much more seen in monsoon seasons. So yes, we have to take our precautions.
So the season affects everyone irrespective of their age. So what are some common illnesses which we see during the season, doctor?
Like you said, rightly said, it affects every individual, but I've said this, young children and young adults are mostly prone to it, but it's not that the adults and elderly people are safe from it. The most common is dengue fever. Of late, we have seen a lot of chikungunya on the rise, which we had seen many years back, but it is on the rise now. But like the most common is dengue fever. So dengue fever becomes a challenge for everyone. So we have to take care of our environment.
So talking about dengue fever in particular, doctor, what exactly is dengue fever, and do you think we all should be worried about this?
Dengue fever is actually caused by the vector Aedes aegypti mosquito, and the virus is flavivirus. There are 4 types of dengue virus, flavivirus: dengue 1, 2, 3 and 4. Dengue fever, as everyone knows, has its own complications. It is basically 3 phases. One is the fever phase, the second is the critical phase, and the third is the recovery phase. I think everyone goes through the fever phase. The critical phase is only seen in about 25 to 30% of the population, which leads to complications, and then comes the recovery phase. Most of the individuals are into fever phase and recovery phase. The critical phase is one which we have to watch for. Then the danger signs are, like I said, fever phase is basically high grade fever, retroorbital pain, which is pain around your eyeballs. Then nausea, decreased appetite, then you may have some rash, petechial rash, where you get small tiny red spots all over your body, or a particular arm or leg. So this is the fever phase. Generally lasts between 3 to 7 days, the fever phase. Then the critical phase sets in for some individuals, not everyone, and that is the warning signs are recurrent vomitings, pleural effusion, where you get collection in your lungs, ascites, where you get collection in your stomach. Then you get very high grade fever which is not coming down in spite of 5 days of your treatment. You have bleeding from anywhere, basically mucosal, gums, from your intestines. For women, menstrual bleeding may start. Hematuria in your urine, bleeding may start. So those are very critical signs. It is called the critical phase, and you have to take care of that, and you have to come to the hospital and get treated for it. Then comes the recovery phase. Recovery phase is again where all your fluid is again reabsorbed and you start recovering. Your fever goes down, your platelets and your WBC count, which has gone down in the critical phase, start recovering. And then it's about 14 days time, in between 3 to 14 days, where recovery happens.
So you mean to say that the critical phase is the most serious phase. So do you think, is there any particular group of patients who are more prone to this phase, or is there any way to predict this?
Well, there was a study where they said that people who get infected with dengue virus, one strain, after 18 months, and once they get infected by the different strain, those are more likely to get critical illness and land into complications. And like I said, children and young adults, these are again the population which gets more affected. So these two groups are more prone to your critical phase and complications.
So we all know that dengue is a viral fever and the treatment for this is mostly supportive. But do you think, are there any latest advancements especially related to treatment? I'm sure there are many myths surrounding this.
There is a vaccine for dengue fever, but it is not proven to be very effective or preventive. They have tried, vaccine is there, it is available, but it has not shown any improvement or any kind of protective like a vaccine should be. Second, it is more of fluid management, which is usually done in the hospital setup, not at home, because of recurrent vomiting, and there is liver is affected, the enzymes go up, gallbladder swelling is there is a loss of plasma leakage, and you get swelling all over your body, is increased fluid. So that fluid management is mostly done in the hospitals. I don't think it can be done at home, people who land in critical phase. Now the biggest myth of dengue fever is platelets. Platelets are falling in dengue fever, and I think everyone would tell you that papaya leaf should be given, or a juice, papaya leaf juice. So that is a myth, that is a big myth. I don't think it causes any protection, or it doesn't cause any increase in platelets. People do believe it because the moment you start giving papaya leaves, it's already day 7 or 10 of illness when the platelets fall, and another 2-3 days the patient is going to recover. He is going to come into recovery phase and it starts rising up. So Indian population does believe that papaya leaves and papaya juice cause that improvement. So it has no role medically. It is not proven that papaya leaves or papaya juice or kiwi has any beneficial effects on increasing the platelet count.
There is also another myth that a particular blood group is more prone to mosquito bites. Do you think there is any truth behind this?
There is actually no fact, but there was a study which said that O positive does have a affinity towards dengue fever, but in a randomized trial they had said that there is nothing like that. Indian population, I think because O positive is more, we see that's about it.
So prevention is always better than cure. Are there any preventive methods that you would recommend for us to follow, especially during this season, doctor?
The prevention is mosquitoes, because the vector is mosquito, and I think the government does an excellent job. It actually does very good during monsoon seasons. Apart from the government, I think every individual has the responsibility towards keeping their environment clean and not letting collection of water stagnant there, because the only reason is mosquito and mosquito. If you don't have a mosquito bite, you don't get dengue fever. It's as simple as that, keeping the environment clean, keeping the surrounding clean.
So before we wrap this episode, doctor, is there any message that you would like to share with our audience out there?
I think keep up your immunity. Please do not avoid breakfast. Drink plenty of water to keep your immunity up. Keep your environment clean, and I think you should be fine. You should be away from infections, and you should be away from doctors. So you should do that.
So thank you, Dr. Arshad, for an insightful and informative episode we've discussed today.
Thank you.
So that wraps up today's episode, and we hope that you found this discussion very informative and enlightening. And don't forget to follow our preventive measures, what we've discussed earlier. And do join us for next week as well. Until then, stay healthy and take care. Thank you.